Interpreting for Healthcare, Ensuring Language Access for All. Welcome to the National Council on Interpreting for Healthcare's monthly podcast, sponsored by the Standards and Training Committee. This podcast is intended for you, our members, the public at large, and everyone working to promote language access and social justice. Join our conversations with some of the best in our field and hear what they have to say about interpreting for healthcare. My name is Yuliya Speroff, and I'm a member of the Standards and Training Committee, as well as a board member of the National Council on Interpreting in Healthcare. Today, our guest is Kevin Thakkar. Kevin is the founder and executive director of American Against Language Barriers, AALB, an award-winning nonprofit that trains medical interpreters and drives language access reform in healthcare. Since 2018, AALB has equipped thousands of interpreters in more than 80 languages, giving hospitals and clinics nationwide the capacity for safe and accurate communication. Kevin shapes organizational strategy, oversees training initiatives, and leads policy advocacy that brings state and federal officials to the table on language access protections. Grounded in public health and civil rights work, he focuses on turning costly miscommunication into clear, patient-centered care. Welcome, Kevin.
Hello, Yuliya. Happy to be here.
Yeah. So as you know, all of our podcasts will ask the same three questions of all guests. And we'll start with the first question. Looking back, what are you most proud of, Kevin?
Yeah, this is an interesting question. I can answer that on a few different levels. Of course, I could say that on a individual and organizational level. AALB, we have been training interpreters for a long time now. So I would say that it always warms my heart when I see students that are not just in the class, but even afterwards, dedicating themselves to actually becoming the best interpreter possible, treating the profession as the art that it really is, continuously improving. And that shows in their work. You can see that instantly. And I'm very proud of those students. Every time I see them on the field sometimes, it's an amazing thing. But I think on beyond an organizational level, on a societal level, I think I'm really proud of where we are as a country, how far we've come in general. That's why we named our organization Americans Against Language Barriers. We are an inclusive society, at least we try to be. We recognize that language access is a right. We have a long way to go, but our country does have pretty strong, on paper at least, federal laws for informed consent in healthcare, for equal protections and due process by having language access in the justice system. All of these things are really recognized. And I think that we really stand on the shoulders of people that have done amazing work. And yes, we have a long way to go, but it just makes me proud to know that this is where our country is. And this is a sentiment that exists among many people.
Yeah. Thank you. And Kevin, I will share with our audience is that I have done some training for AALB. And so I really share your pride because I have encountered our alumni, our former medical interpreter trainee students out in the field. In my main work in a hospital, I've connected to interpreters and they were one of our graduates. In my volunteer work, I've called for an interpreter and I recognized the voice of one of our interpreters. And it's always such a proud moment and to know they're out there doing, their best work. So that's a great feeling. And, but I have to say, I would love to learn more about the civil rights advocacy, some of this work you're doing.
Yeah. It's really interesting and a little bit frustrating also to think about where to start because we spent at least a year trying to map out in the beginning, like where should we even be going in terms of the work we do. And I see us training interpreters as a form of civil rights advocacy. I'll talk about that specifically, in terms of direct advocacy. But Yuliya, as you know, you were one of the first 4 trainers to start with us. And from the beginning, we wanted to train interpreters so that people actually get interpreters in the field. We saw people not receiving interpreters simply because there was a workforce shortage, especially the in-person interpreters that are qualified and well-trained. A lot of people, of course, can be bilingual, as they say, but I think people listening to this podcast will know that having a qualified interpreter really is what makes a difference. Now, I think in terms of like the specific civil rights advocacy that we're doing, I think one of the things that I really would love to share is that we're working on a relatively new program called the Language Access Watch, which really allows everyone to become a civil rights advocate in their community if they want to, by working with us and partnering with us and using our model. And the idea is that in healthcare, though we focused on training medical interpreters, we know people are not always receiving the qualified interpreters in healthcare, but it's a little bit of a black box. It's hard to see what's happening there because of confidentiality laws and HIPAA, of course, but in the legal system, in the justice system, during courtroom trials, we actually have the right to be there. The right to a public trial is part of the Constitution. So there are a lot of trials, most trials, in fact, are open to the public. And when an interpreter is not provided there, it is a matter of public record. And unfortunately, one would think, I think the assumption that we hear the most often is that, of course, people get interpreters in the courts, of course. They're being watched. And most of the time they do. But if one observes the courtrooms for long enough, they will see egregious violations of due process and equal protections. I was just investigating a courtroom earlier in Chicago. We were observing them that we received a complaint that their mother was not being provided an interpreter, and the judge was pushing them to continue in English, saying that she doesn't need an interpreter, but she was excluding the mother from her own trial and talking to the daughter during the trial instead. So the mother had no idea what was going on. She was a 94-year-old woman, limited English, hard of hearing. So multiple things going on there, ADA violations too. But, these are things that are unfortunately happening on a systemic level, even in the judicial system. And we need people to be there during public trials to actually document this happening so that we can report it to the Department of Justice, because the intention and the Department of Justice is to have interpreters, right? These are individual judges and things like that are potentially not following the protocol, right? So that's what we want to document and make corrections when necessary. And I think when on a systemic level, when we have various communities doing that, I think that's really the only way forward. I don't think that we as an organization could ever do enough to actually change the system. We can only create another system to make a change on a population level.
Okay. Well, thank you for explaining it so well. And I think, you should also be proud of the fact that within one organization, not that I'm telling you how to feel, but, within one organization, you are finding multiple ways to advocate for civil rights when it comes to communication, when it comes to folks with limited English proficiency.
Yeah, we started this organization, AALB, with the idea that this will be an endowment for language access. So whatever we generate as a nonprofit, we invest it back to the community. Whatever fees we charge people for training, we invest it back in them to make them best interpreters possible. And over time, as we grow, we really want this organization to monetarily support language access. So we're investing in programs that would not otherwise generate revenue through our private revenue that we generated through other means. Like so far, we've not really done fundraising. We haven't done grants. We've really just been providing services. Eventually, as a nonprofit, we're going to go into fundraising and grant writing, but we really so far focused on providing services that we can reinvest to continue to advance language access. And so with that model, I think that we can have some momentum going, at least in the beginning. So I still think we're in the growth stage, but I think in the next 10, 20 years, we will have systems that are self-sustaining, hopefully.
Wonderful. And thank you. And I wonder, Kevin, in the time that you have been doing this, both the interpreter training side, the Civil Rights Watch program that you're doing, what are some things that you have learned? Maybe you've learned from your mistakes, maybe you've learned from some successes.
Yeah. Of course, I've learned that this issue is not really going to be solved unless we involve the community that's being impacted by it. So we as interpreters, I'm an interpreter myself. We as interpreters cannot be the only ones advocating for the rights of limited English and deaf individuals. They have to be included in the movement, of course, naturally. And so this is just a very big challenge, especially when it comes to, in the United States, limited English individuals. Of course, even with deaf individuals, we have so many different sign languages that are signed, and most deaf individuals are not actually fluent in a sign language. So that's also a challenge. But I've noticed that the deaf community is a little bit more well informed of their right to an interpreter, whereas the limited English community, they might not be informed of their right. They might come from a system where those rights don't exist, from another country. They might not want to cause waves in the system. They stand out for whatever reasons. They might be thankful to just be getting healthcare. And they might not understand why an interpreter is needed, even if they know the right. So I think this is a challenge, but I think that we should be addressing this. I think this is really should be the focus of us as an organization. So how to best involve deaf and limited English individuals to advocate for their own rights. And so I've been thinking about how to get them involved in the Language Access Watch, but maybe we have to create another program. I'm not quite sure. I'm still pondering, and I would love to hear from the community about what they think the best way to go about that is.
Okay. Good question for our audience, potentially. If you have ideas, you can reach out to Kevin. And that brings me to our next question, which I think you kind of started talking about. But currently, what do you see as the biggest challenge?
Yeah. I don't necessarily see this, they're including the limited English and deaf community as the biggest challenge. I think this will happen naturally over time, but I mean, obviously I want to catalyze that, but I think that really the biggest challenge is maintaining the civil rights that have been created, which, I perhaps if they are included in maintaining those, that will be easier. But right now, just looking at the federal laws, especially in the federal level, they're on weak grounds. So for example, the definition in healthcare, the definition of a qualified interpreter under Section 1557, right? That is actually a regulation, which means it can be changed at any time, like we saw in 2020 and then 2024. One person essentially can change it if they want to. The secretary of the HHS, of course, they have to go a period of public comment and things like that. But the point is, it's much easier to change than a statute where they'd be having to undergo Congress and Senate, and that could be a good thing or it could be a bad thing. But the fact that it's so easily changed, I see as a danger. So tomorrow, the definition of a qualified interpreter could include all family members, right? Doesn't necessarily have to be a trained interpreter anymore, depending on the sentiment of the HHS at that point. So I think that's one thing that's a danger. So I think we need stronger laws and regulations protecting limited English people in healthcare on the federal level. We have some state-by-state protections that are stronger, luckily, but of course, most states don't have that. And also, judicial precedent is really what defines the right to an interpreter across the United States. Title VI did not provide the right to an interpreter for 10 years until the Supreme Court case in 1974. And so the Supreme Court changed the way that Title VI is interpreted, and this can change again. If there's another case brought to the Supreme Court in which they say, this was not the intention of Title VI. This was not the intention. National origin is currently tied to the language one speaks. But if the courts believe that's not the intention, if that's somehow, I'm not saying it'll happen, but if it's somehow taken away, then that might change the entire language access industry, the field, and I think that the limited English people would suffer quite a bit if that happens. So I really think that there needs to be stronger laws and regulations. We have the Court Interpreters Act and for the judicial system, and I think we need to see a similar act in the medical system.
Yeah, thank you for sharing that, Kevin. And you're right, this is something when we think about regulatory guidelines and federal guidelines, this is something that we often fall back on when we're talking about, people's rights to language access. And it is a scary thought that this may not exist or exist in the shape that it currently does. And, I'm also curious to know, you're talking about, when it comes to biggest challenge, when we're thinking about threats to language access rights, you're thinking about the laws. I know or at least I think I know you've met with some lawmakers and some officials in Chicago area. Is that something you'd like to talk about?
Yeah, I think, we have met with individuals that have, decision-making capability in Chicago and things like that. But in Illinois, we really have pretty strong laws and regulations for healthcare. And I think that we have uh, congressmen and women that really do have the sentiment that language access is a right. So I found that in Illinois, it's really not an uphill battle whatsoever. They're always willing to meet with us. They're always willing to hear us out. I think we had a language access task force by the governor, I'm sorry, recently. So it's something that in Illinois that has not been a challenge. I think that uh, Congresswoman Theresa Ma, I would love to shout her out. She has been very helpful in advocating with us for some of these rights in Illinois. She supported the Language Access Watch, for example. The Illinois Supreme Court has been really willing to work with us in order to administer the Language Access Watch. And they might be sending a speaker to our conference, hopefully. So Illinois so far has been a really easy state to work with. But what we found to be challenging is actually federal. And we haven't really made an attempt in the last year or so, but even before that, it's been quite difficult. On the I will say that I've noticed that from the Office of Civil Rights in the previous administration, when sentiment was good, they strengthened they strengthened the essentially uh, the law to make the regulations for definition of qualified interpreter stronger. Um, I noticed that they were really willing to listen to us and work with us as well. They sent a speaker to our conference, Jenny Ma, but I noticed that there's not really much they can do, because the way that the laws are structured, the enforcement mechanisms for violations of Section 1557 are extremely weak. They go back to Title VI. They're based in Title VI, and that is from the 1960s during desegregation. So there are so many compromises that happened when they were talking about how do we enforce these laws. And so we undergo something called the voluntary compliance when someone violates the law. There has to be an investigation, they undergo voluntary compliance, and if they voluntarily comply with the law, nothing happens. There's no fines, nothing like that. They're essentially saying that if you choose to start providing interpreter services from now on, we will not take away federal funding. We will not do any fines. It'll be written up as a success story on the website. And this essentially results in organizations flying under the radar until they're caught. Okay, and once they're caught, then they start following the law, but there's no deterrence to follow the law until they are caught. So many medium-sized, small organizations will just not provide interpreters until someone reports them. And so this is something that we've been trying to improve and trying to find a path forward to try to essentially improve enforcement mechanisms. And I think really, like I was talking about earlier, I think really the only way that we're going to be able to do that is by actually creating a new law, which I don't see happening on the federal level anytime soon. So I think it needs to be done on the state by state level.
Got it. Thank you for thank you for sharing that. And I find it reassuring that you working within Illinois you've been, being able to find folks that are willing to cooperate and who are interested in this work. But certainly disheartening to hear that you don't think the new law, a different law, is going to be passed anytime soon. And that really brings me to our next question. Looking forward, what would you love to see happen? Let's dream, Kevin. Let's dream
Yeah.
big.
And I often think about this. I feel like I did actually have a dream about this happening at one point. So I would say that this question I can answer pretty easily. I would love to see artificial intelligence actually improve the lives of limited English people. I think it's a game changer. Um, I've seen it interpreting Gujarati, the language I speak. It's impressive. Okay, it's very impressive. If it was able to support an interpreter, a human being, or if an interpreter is there to support even the AI, I think that limited English people would have a much stronger ability to access healthcare services and in other fields as well. Um, I don't think it should be a crutch. I don't think it's something that should be used without a human at this point. At probably anytime in the future. Of course, it hallucinates and things like that. But I'm more hopeful than I am pessimistic. I've seen lots of pessimism in that regard of it taking our jobs and things like that. And I think that's really just pessimism towards corporations wanting to profit as much as possible. But I think when we take that out of the picture, if we isolate simply the technology, it's a game changer, and especially for low resource countries. Like I think of India, one of the a really low resource country that is one of the most linguistically diverse countries. They've always had issues with interpretation and just trying to communicate between states and things like that. Always cause many debates. I think this will change the country, and I really do think the same thing can have it has a potential to change the world really for the positives. It just depends on how we use it, right? With any other technology.
Yeah. Kevin, when you started saying that, part of me just wanted to dive in front of the camera and say, stop, don't say good things about AI. But on the other hand, there's me who is an interpreter, who is part of an interpreter services department in a hospital. And, I very much feel and share everyone's anxiety about AI advancing. But I was recently at a training that was actually about, how to be an irreplaceable as an interpreter by the wonderful Andrea Henry. And I saw a comment by someone that really resonated with me. They said, we shouldn't necessarily be worried about being replaced. We should focus on the less quality of care. And so, in that spirit, I think, your hope, where you're thinking it will change things for the better, that, does make me happy. On the other hand, I think, how realistic is it to expect folks to really, despite all of these amazing tools that are coming out, from the National Council on Interpreting in Healthcare, from Safe AI, these guidances on evaluating AI that's being offered to you. You're a hospital, you're another organization, and this company calls you or emails you and says, hey, we have this amazing tool. It's going to save you tons of money. It's HIPAA compliant. It is so safe. How do you evaluate their claim? So these guidances do exist. And, you know, how do we make sure that folks do really think critically about this? I have spoken to some doctors who say, I really want my patients to walk away with discharge instructions from the hospital. You're telling me it takes a couple of business days, but I want it now. So isn't it better than nothing that I use ChatGPT or Google Translate, to translate it so they're walking away with something? And, and to your, Kevin, when you're saying, a country with low resources, it might be transformed by these new amazing technologies. But I'm also thinking, when we're saying, is this better than nothing? In case of some languages, like we're constantly experimenting at work with Amharic, Tigrinya, Somali, where we run it through ChatGPT or Google Translate. And some days it makes sense. Some days it hallucinates a story about a person that has nothing to do with discharge instructions. Some days it says, instead of continue taking your antibiotics, it'll say continue taking your anti-sol medication. If I were a patient, I would not be taking anti-sol medication. I'm very fond of my sol. So yeah, I'm just curious about, where do you see kind of the balance coming in from the critical thinking? What is maybe our responsibility as interpreters, or your organization's responsibility in this?
Yeah, I think that as you know, for someone who's been interpreting for a long time, providers have always used Google Translate and things like that as a crutch, and it's been a much, much worse technology than what we've seen in the last 5 years. But I think now more and more providers are seeing that as okay because of how much of it's improving. So it is a challenge. I think in the next 5-10 years, it's probably going to be chaos. And unfortunately, I don't think we have an Office of Civil Rights that's has the sentiment of enforcing the laws and regulations that exist on the book, which do say that you should not use AI to interpret in healthcare, right? So the technology is not there yet, of course, to make it safe. I'm hopeful that it needs more data. It's getting there. I'm thinking from the perspective of a limited English individual. more so than an organization that's training interpreters or as an interpreter myself. As a limited English individual, I would be so thankful to have the technology to pull up my phone and just have language access for almost free. I think that just gives me hope that's starting to exist. I don't think it's necessarily there yet, and I think it's chaos for the short to medium term future where it's unregulated, essentially, is what you're getting to, and that it's when something's unregulated and there's a lack of enforcement, what can we do, right? I think lawsuits are what need to happen. I think limited English individuals and deaf people start to, if I know they're working on AI sign language, by the way, right? I think there needs to be lawsuits happening for people that misuse these technologies. And when there's harm that will inevitably come from a discharge paperwork that's just a story of, that's irrelevant to the care, and someone does not know what to do or how to take their medication and maybe overdoses or is harmed in some way, that will be clear negligence, and that might change the industry. Unfortunately, we see tragedies like this resulting in change, and that's typically the driver of change in this industry, like we see and so many times in the past.
Yeah, that 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 is a good take on this because again, your answers make me think of really the positive side of this, the dream that we have about ubiquitous language access, right? Accessible to everyone. But then there are so many folks that are looking to capitalize on these opportunities without really maybe the background knowledge or the understanding of the complexities of interpretation in healthcare. I keep seeing this ad on Instagram for an app, and it says, you never have to wait for a translator in a hospital again. You can use this app. And I think, wow, friends, if you are going to advertise a product, please research terminology, please at least sound legitimate, sound like you know what you're talking about, right? Like nobody in the language industry would say hospital translator when they're really talking about interpreters,
And it's unfortunate because the people that are in charge of compliance and hiring and being, hiring interpreting organizations and things like that will not notice these mistakes oftentimes. And they'll be like, oh yes, hospital translator, that's what I need. And there will be, the reason that ads running is because people are paying them, like that there are people that are okay with that, and don't quite understand what the actual compliance requirements are, unfortunately. And I see that as this at large academic institutions too, not just small hospitals, unfortunately.
Well, that is a scary thought. And I don't know, if you ever see this ad, you'll probably see some of my comments under it. I'm hoping you'll add yours
Yep.
as well. But you know, when you mentioned that folks that are making decisions may not also be aware of the language access and terminology. So what do you see, what would you love to see happen going forward with maybe decision makers who make these decisions for hospitals, for courts?
I think they need to be licensed. I think they need to undergo a government licensing. If they're going to be the ones that are deciding whether or not interpreters need to be provided, what kind of interpreters need to be provided, there needs to be some sort of training on the laws and regulations that they're supposed to be complying with. And I mean, I don't know if licensure is necessarily the right path or some sort of certification training or something, but it seems
Okay.
like the total Wild West, right? It seems like anyone can just do whatever they want.
Okay. So like an MBA, but with a language access um, specification?
Yeah, I mean, I don't think it's something that's would require even like 40 hours of training. I think someone could take like a 10-hour self-paced under training and really understand what laws and regulations they have to follow, some state by state customization. We haven't created something like that. We probably need a team of good lawyers to be able to advise a compliance department. But I think that that's something that would solve the problem, because it seems right now that they kind of just learn on the field and hope they make the right decisions. So I'm not sure. Maybe they just need to hire a good lawyer. I'm not sure.
Okay. Well, sounds like we mapped out some work for you, an area of research for you to do in
Yeah.
the future. All right. Well, thank you so much, Kevin, for being here today. And to our listeners and viewers, please join us again next month as we discuss what's happening and how to improve interpreting for healthcare.
Thank you.